Okay, so looking at another aspect for systemic examination for acute abdomen. So in systemic examination, it's more of like the patient has come, you have seen the patient's condition. So you are now going to you are trying to go around all the other systems of the body, right? So going around all the other systems of the body, you are basically trying to point out if there's any other complications, all right, associated with the acute abdomen, all right, so that in all you can be able to make a diagnosis and you can be able to have good differential diagnosis. So for the cardiopulmonary examination, you are trying to check if the patient has myocardial infarction, basal pneumonia, pleural effusion. All right. In the abdomen, you are trying to inspect, look at the shape of the abdomen. Is it scaphoid or flat? All right. Is it distended, like big? All right. Visible peristalsis. All right. Then erythema and discoloration. On the abdomen, is there any different color, periumbilical occult sign, inguinal fork sign, all those flanks gray tonal sign and all of that. That one is usually seen in hemorrhagic pancreatitis. Is there any visible masses? Is there any visible cough impulse? So for the abdomen, you palpate, be gentle, you start away from where the patient pointed that this is paining me the most. So you start away, all right, before you come. Check for possible hernias, check for tenderness, check for rebound tenderness, check for muscle guarding, all right, then check for rigidity. So these are the 9 quadrants of the abdomen and possible disease conditions that if the patient points to this side, you can be suspecting that side. You understand? So this one is basically something that you can pause and look at it, possibly you write it down. All right. So if there's local right iliac fossa tenderness, you see. So this is just what we are trying to look at. All right. So you can see this should be the right iliac fossa. So appendicitis can be suspected, salpingitis can be suspected, amoebiasis. All right. So if it is low-grade, poorly localized tenderness, intestinal obstruction can be suspected. Then tenderness out of proportion to examination, things like mesenteric ischemia, acute pancreatitis. If it's flank tenderness, right, either on the left or right, perinephric abscess, all right, retrocecal appendicitis, all right. Then renal angle tenderness is basically inflammations or infections in the kidney. All right. So Murphy sign can be seen in acute cholecystitis. Kerr sign can be seen in splenic rupture or splenic abscess. Okay. So you end your everything with rectal examination. So in the rectal examination, you're trying to see if the walls of the anus are tender, there's induration, there's a mass, there's frank blood. All right. Then for women, you also do vaginal examination where you're checking for bleeding, vaginal discharge, cervical mucous tenderness, adnexal masses, uterine size or contour. Okay, so these are the various things you consider in doing systemic examination for a patient that has a sudden pain in the stomach.